As patients, carers, members of the Philippine Alliance of Patient Organizations, we breathe disease and death every day.
It is a struggle on all fronts, physically, mentally, emotionally, spiritually, and financially.
It has its disappointments, but also high points, as we encounter kind, healing souls along the way. But just when we thought we had it tough, made our fears bigger and deeper.
We cannot afford another disease, nor can we afford to put up a fight on all fronts. This is not our fear alone. Never in the history of mankind that there has been a disease that destroyed and disrupted so many lives and hope all over the world.
The COVID-19 vaccine is offering us hope. It is not perfect, but at this moment, it is our best chance to stop living in fear and to start living in hope.
This will not work if only a few of us chose to be vaccinated. All of us need to get the vaccine because no one is safe until everyone is safe.
PAPO stands solidly with experts and advocates for COVID-19 vaccine. We invite you to join this call of unity as we launch Bakuna Now Na to address the infodemic and help increase vaccine acceptance.
Never in our history has there been a more urgent call to stand united, get vaccinated, so together we can overcome COVID-19.
Bakuna, now na! Bakuna, now na!
Bakuna, now na!
Bakuna, now na!
Bakuna! Now na!
Bakuna! Now na!
Bakuna Now Na!
Bakuna! Now na!
Bakuna, now na!
When it comes to how many kids Filipino couples want to have and how many kids they end up having, meron tayong nakikitang pattern. Parents usually end up with one child more than what they initially wanted. At ang pinakamahihirap na pamilya, sumusobra pa sila ng dalawa. Pag mas malaki ang pamilya, mas lumalaki rin ang posibilidad na maging mahirap ang pamilya. Poverty leads to children growing up not reaching their full growth and productivity potential. Responsible parenthood and family planning is one of the 3 program components of the Philippine Population Management Program. Tugon ito sa pangangailangan para sa epektibong pagpaplano ng pamilya. RPFP has 3 goals: 0 unmet need for modern family planning, pataasin ang paggamit ng modern contraceptives to 65%,
at maiwasan ang di inaasahang pagbubuntis,
lalong-lalo na para sa mga mahihirap na kababaihan. Sa RPFP, matutulungan ang mga couples na ma-achieve ang tamang pag-aagot ng pagbubuntis at ang bilang ng gusto nilang maging anak na kayang bigyan ng maayos na tahanan at kinabukasan. May iigtingin ng kampanya para maipatupad ang Responsible Parenthood and Reproductive Health Law at Executive Order No. 12 sa mga lokal na pamahalaan. We'll use communication campaigns to promote responsible parenthood and family planning, natural man o artificial methods, upang tumaas ang demand para rito, especially among poor women and families. Ilalapit natin ang reproductive health services at contraceptive commodities sa mga mahihirap na komunidad para ma-access ng sino mang gustong magplano ng pamilya ang family planning method na hiyang sa kanila. With the Responsible Parenthood and Family Planning Program of the Philippine Population Management Program, we'll make sure that couples and individuals have the knowledge and support they need to start the family of their dreams. Empowering Filipino families.
Labanan ng COVID-19, ang kailangan natin ay tama at totoong impormasyon, hindi fake news. Huwag kaagad maniniwala sa nababasa at naririnig. Ang pagkalat ng mga maling paniniwala tungkol sa COVID-19 ay nagdudulot ng panik, takot at maling desisyon. Laging i-double check kung saan nanggaling ang nabasa o narinig. Maging mapanuri at i-share lamang ang tamang impormasyon. Sa wastong pag-iingat, ang virus hindi kakalat. COVID-19, kayang-kaya nating tapusin.
Patuloy pa rin ang laban natin sa COVID-19. And together, we can beat the solusyon.
B. Bawal walang mask.
I. Isanitize sa mga kamay. Iwas hawak sa mga bagay.
D. Dumistansya ng 1 metro.
A. Alamin ang totoong impormasyon tungkol sa COVID-19.
Protektahan natin ang sarili at mga mahal sa buhay.
BIDA. Beat the solusyon sa COVID-19.
Magandang gabi po sa inyong lahat. Welcome to another episode of Alaga Live Check-Up. Alaga Health Live Check-Up brings you all of the latest happenings pagdating sa ating kalusugan. And ang maganda po dito, this week, we are celebrating the Filipino Elderly Week. Yan po ang ating special for today. Mga lolo at lola po ang ating bida. And today, we are very, very much privileged to be joined by our guests. Mga batikan pagdating sa healthcare at na rin sa pagbibigay ng impormasyon tungkol sa pangangalaga ng kalusugan. And of course, joining me on this program is none other than the lovely, the beautiful Doc Jucille Roderos. Good evening, Doc. Hi, Doc V.
Alright, there you go. Good evening po sa ating mga viewers. Good evening, Doc Dex. I'm very excited for another episode of Alaga Health. And particularly, itong episode na to ay very special, especially kay Doc Dex. Kasi kasama niya ang kanyang mga mentors before who guided him to become the healthcare professional that he is right now. So I'm very excited. This is the first time I'll be meeting them. And I'm sure marami tayong matututunan sa kanila regarding healthcare and paano ba natin pangangalagaan ang ating mga mahal na lolo at lola during the time of the pandemic. So Doc Dex, without further ado.
Paano ko ba i-introduce to? Kasi talagang these are some of the people na I really look up to. Kasi po, apart from taking my Doctor of Medicine degree, I am also a registered nurse. And ito po yung mga humulma sa ating isipan pagdating sa pagiging isang health professional. So, without further ado, let me now introduce to you from the Gerontology Nurses Association of the Philippines. Let us bring to the show. Up first, tatlo po kasi sila eh. Up first, none other than Sir Razalan. Hi sir, good evening po. Welcome to Alaga Health Live Check-Up.
Hello po, magandang gabi po sa inyo lahat. Dr. Dex and Dr. Bia, magandang gabi sa inyo at sa ating mga televiewers right now.
Yeah, and thank you very much, sir. Sir G is the current president of GNAP. Yan, and of course, joining him, none other than someone I really love, and sobrang bait niya talaga ever since I was in nursing school pa. Let us bring to the show, the lovely, the beautiful Ma'am Susan Pagsibigan. Hi, Ma'am.
Thank you, Dex. Thank you. See, I've met Dex in his second year, and I was already impressed by his views about life, not only nursing, and I am happy that he thought about us during this time. Good evening po sa lahat ng mga viewers, and of course, Doc Dia. It's a pleasant day for us to meet you then. Thank you.
Thank you for that, Ma'am Susan. And ang kukumpleto sa ating trio tagapayo, for lack of a better term, ay isang haligi ng gerontology in the Philippines. And she is none other than, again, the lovely, the beautiful Ma'am Lydia, Ma'am Legs, Manahan. Good evening, Ma'am.
Good evening. Magandang gabi po sa lahat ng mga nanonood. Siyempre, magandang gabi din kay Dexter, ang aking paboritong estudyante, at kay Doc Bea. So magandang gabi po. Actually, natutuwa kami na naimbitahan kami ng aming estudyante. Sana hindi ito payback time, no?
Ako naman ngayon, ma'am, ang magtatanong ng question na galing sa ating mga pasyente at ating mga viewers para naman mas marami tayong malaman tungkol sa pangangalaga ng ating mga lolos and lolas. And of course, since today we're celebrating the Filipino Elderly Week, maybe it's time for us to learn more about why we're celebrating it, and of course, ano ba ang role ng GNAP pagdating dito. So maybe it's time for our first segment, the Alaga Health Startup. Yeah, welcome to Alaga Health Live's check-up, no? And of course, ito yung first segment natin ay ang ating startup wherein we will be asking our special guests to share kung bakit nga ba natin sineselebrate ang Filipino Elderly Week and to give us a little bit of an insight kung ano nga ba ang ginagawa ng GNAP. So, sino po ba ang ating magiging first speaker? Nag-usap-usap daw po kasi sila Sir Gio, sila Ma'am Susan at si Ma'am Legs kung sino daw po ang mauuna. Nako, so sino po ba ang ating unang alay ngayong gabi?
Sabi nila, ako, dahil Filipino Elderly Week, at gusto kong sabihin, hindi lang Pilipino ang nagse-celebrate ng Elderly Week. It's all over the world, actually. So, almost all organizations are celebrating the Elderly Week. And this is to focus the care of the older persons. Actually, yung elderly, ayaw na namin paggamit. Older persons. We call them older persons. Yes.
Yan. So iba na daw. Huwag daw elderly week, older persons.
Yes. Kasi pag elderly daw, period na. Pag older persons, coma pa lang.
Okay.
Mahirap mag-period, ha?
Ganda ng opening ni Ma'am Legs. May idadagdag po ba kayo, Sir Gio and Ma'am Susan?
Okay, siguro ako naman napag-usapan namin ako. But my focus is, ano ba yung trust ng GNAP talaga? Ang trust ng GNAP is really to help each other, train ourselves to become better carers for the older person. So ang target talaga namin is to level up the standards of care of our nurses. But of course, kasama na rin dito are the partners that they have in the institution that they work in. So most of the time, may sinasama rin sila like ibang disciplines, like for example, yung mga connected with DSWD, aside from the nurses, they bring with them the social worker and some of the caregivers that they have. And of course, because of this, we also have with us, and I guess Gio is going to expound on this, other partners who helped us train our nurses. Particularly, the model that we had was our DOH scholars. Ito yung mga nurses na deployed sa mga DOH-run hospitals who plan to have their own geriatric center. So, Gio would inform us later about it. So my task is really to invite more nurses to join us para naman matulungan kami to improve the care of the older person through our nurses. Thank you. So Gio, take it away.
Yeah.
Okay, salamat po.
Sir Gio naman daw po.
Okay, salamat Ma'am Susan. Allow me, Dr. Dex and Dr. Via, bago ko sabihin at himay-himayin yung tinatawag nating mga programa ng Gerontology Nurses Association of the Philippines. Pasalamatan ko muna ang aming immediate president, si Dr. Araceli Obalabagno, kasi sa lahat ng mga inisyatibo na meron kami, malaki ang na-contribute niya para dun sa current na mga programa ng Gerontology Nurses Association of the Philippines. First and foremost, we have basic course in gerontology nursing. It's actually a 4-day training for professional nurses in the care of older person. And we also have yung tinatawag namin 3 months intensive training in gerontology and geriatrics and the 5 days preceptorial leadership training and clinical teaching. With, of course, our partner institution like Bicol Region General Hospital and Geriatric Medical Center, headed by Dr. Ed Sarmiento. Both programs na merong ang GNAP pagdating sa 3 months and 5 days preceptorial leadership training, that program is of course funded by the DOH under the HHRDB, their certification program. So from that program, we're able to train 100 nurses from various regional as well as of course national, retained, and specialty hospitals of the Department of Health. And last August 31 to September 2, GNAP jointly with the UPCN implemented the 3-day pilot training in geriatrics for primary healthcare providers. This is actually a project with the DOH and the WHO, which was attended by the regional coordinators of the Department of Health. And of course, we are also hoping to run our second batch this October. And We also have the national and annual convention in relation, of course, in line with our founding anniversary. And most of our programs are in partnership with the UP Manila College of Nursing. And of course, we are as well as grateful for the support extended by Dr. Sheila Bonito, the Dean of the College of Nursing, for all of our activities and projects. Now, in terms of GNAP's capacity building and linkage, we partner with our partnership and involvement with the DOH program on health and wellness for senior citizens under Dr. Mimi Binduan, HHRDB and CP under Dr. Fletch Tolentino, UP Manila NIH Institute of Aging under Dr. Shelly De La Vega, and of course with the UPOU for the postgraduate in nursing. We are as well as in partnership with the Fragility Fracture Network Philippines under Dr. Erwin Tabu for ortho-geriatric nursing training, and with the Western Pacific Palliative Care Advocacy Network. So yun yung mga common programa natin pagdating sa Gerontology Nurses Association of the Philippines.
Yan, grabe. Ang daming partnerships, ang daming collaborations both with government and civil society, plus even the private sector. So I think hopefully we could invite everyone to like and follow your Facebook page. That's www.facebook.com/GNAP Philippines 2021. May bago pong page ang GNAP, no? So, hopefully, you now know a little bit more kung ba't tayo nag-celebrate ng Filipino elderly, dapat the older persons week na, and of course, ang story behind, no? GNAP. Yan. So, with that being said, maybe it's now time for us to jump to our questions. Okay. So, let's go and jump into it. Now, ready ka na, Doc B? Now, first time natin na may full panel ng mga expert nurses, mga doctors, mga PhD in nursing, masters in nursing. Nako, talaga mga batikan when it comes to healthcare. So, let's get to it.
We're very privileged, Doc Dex, no? Na we are joined by our friends, na our allies in healthcare, no? And they are actually championing something that is very close to our hearts, yung mga lolos and lolas natin. And mga older persons, no, na forever na magiging young at heart, no? Like like our guests here, of course, no? So Doc Dex, I think they're very ready for your questions.
Let's go with question number 1. Okay, so the first question is from Ma'am Remedios Cornejo. Ma'am Remedios Cornejo. According to her, magandang araw po. Ako po, yan, no, sa screen. Ako po si Remedios Cornejo, 62 years old. Older persons talaga. Kadalasan yung BP ko ay 150/90. Sabi ng anak ko, kailangan ko na raw ulit uminom ng, hindi ko gamot to, gamot. Pwede bang hindi na, no? So, sige. Let's give our special guests today. Nako, ito yung mga nagturo sa akin kung paano gawin ang proper nursing education, lalo na yung sa pag-i-instruct ng pag-inom ng gamot. Nako, so let's listen sa ating advice from maybe Ma'am Legs, Sir Gio, or Ma'am Susan. Sino pong gustong kumuha?
Parang gusto kong mauna dahil according to seniority, hindi older persons ngayon, di ba?
Pwede.
Actually, ang masasabi ko kay Aling Remedios, yung BP na 150/90 ay mataas na talaga. At parang nahiwatigan ko din na kailangang uminom ulit ng gamot. Dati ba siyang umiinom ng gamot? Yun ang mga dapat nating malaman eh. Pero sa totoo, Ma'am Remedios, yun pong 150/90 ay mataas na. At hindi po kaya kailangang iinom agad kayo ng gamot. Ang una po nating dapat gawin ay pumunta sa doktor kasi sila yung titingin kung anong gamot ang pwedeng ibigay. Madami po kasing klase ng gamot at sila po ang makapagsasabi kung ano yung gamot. Kasi sabi, uminom ulit, hindi pwedeng ulitin ulit yung gamot nang hindi nakikita ng doktor. Napaka-importante po noon.
Very important yan, tama si Ma'am Legs. Actually, sobrang tama. Sige, si Ma'am Susan po. Yes, ma'am.
Yeah. Si Remy ay mas bata sa akin. 62 years old lang siya. So, I would believe marami pa siyang gustong gawin. And I think she feels good about herself. That's why she's thinking wag na lang siyang uminom ng gamot. ganun din ang aking pananaw dati. But however, because I have other conditions such as diabetes, which you know is a very high risk also for developing cardiovascular disease. Kaya sinigurado ko rin na magpatingin kasi ayoko, kahit na maalam ako sa maraming bagay, gusto ko rin sasabihan ako kung ano ba talaga ang dapat kong gawin with my age. Kasi my high blood pressure came out when I was about over 50 already, before I joined the UP College of Nursing. So doon nakita ko na I have all the risk with me, slight obesity, and then of course my blood sugar. Tapos yun nga, nagpakita na sa akin yung yung high blood pressure. So I was prescribed, and ang feeling ko, kailangan kong sumunod. Number one, kailangan kong pababain yung sugar ko, and para naman tama yung gamot ko kahit na dun sa blood pressure. The medicines are very expensive, so I was really trying to discipline myself. Dinidisiplina ko po ang sarili ko kasi feeling ko po mas mahal pong uminom ng gamot kaysa magkaroon ng mag-adhere sa healthy lifestyle sa pangangalaga sa sarili. So with that, tao lang po ako. Paminsan-minsan pag bumaba na po yung aking sugar at sumama po yung aking blood pressure, ang feeling ko po okay na ako. Parang, kasi alam mo yun, meron ka talagang needs sa sarili mo, meron kang ibang paniniwala na akala mo okay ka na. But of course, at the back of my mind, posibleng hindi ako okay, no? So, nangyayari yon sa iba't ibang portion ng aking buhay. So, hindi lang yung time na yon na nag-stop ako dahil umokay naman yung aking sugar at saka blood pressure. Pero nare-realize ko as I grew older that kahit na mababa yung aking blood pressure, pero mataas ang aking sugar, parang may alerto sa akin parang naaalarma ako na, hindi porket okay yung blood, kasi dito, dahil din sa pagsasaliksik ko at pagtuturo ko sa mga estudyante, kailangan tama yung tinuturo ko, sinabi nung pananaliksik ng American Heart Association na pag ikaw ay diabetiko at dati ka nang may high blood pressure, ang normal blood pressure mo ay hindi 130/80. Ang normal blood pressure na itinatarget mo ay 120/80. Kasi ina-avoid daw po yung complication. So I told myself, naku, kailangan ko mag-maintain ng aking para sa blood pressure ko. And then recently, dahil nga 60 na ako, I again consulted. Kasi may time talaga na hindi ako umiinom. So tinanong na naman ako about my blood pressure pills, and then yung mga pampatin ng dugo, mga ganon, pampababa ng cholesterol, and all those I really stopped taking kasi feeling ko baka mamaya magkaroon naman ng complication sa aking mga ibang systems. You know how the drug works in your body. So syempre medyo naglaylo muna ako. And then he said, no, don't do that because at when you reach 60 and above, you can never say that you are okay. It's better to prevent the complications of diabetes. Although it's controlled, it's maganda daw balita yon na kontrolado ang aking blood sugar. Pero at the same time, lahat daw kailangan tingnan ko. Yung aking cholesterol, kung okay daw ang aking BP, 120/80, okay daw yon. Pero kailangan ituloy ko pa din. Nag-a-adjust lang po yung doktor sa mga binibigay sa akin, pero talaga pong meron akong mini-maintain na gamot. Minsan binababaan, minsan pinapalitan. So, pero I am honest with my doctor. Sinasabi ko na, doctor, ang mahal kasi ng mga gamot. So, sinasabi naman niya sa akin kung anong pwedeng ipalit kung sakaling namamahalan ako. So, yun lang. So, yung tanong mo, Remy, kung kailangan ba na mag-start ka mag-meds, kailangan maging honest ka sa doktor mo at saka sa sarili mo. Required po akong kunan ko yung sarili kong blood pressure at mag-maintain po ng record sa aking mga resulta ng labs ko. Kasi yung doctor naman po naniniwala sa mga resulta basta ipakita ko lang sa kanya kasi nagbabago din po yung i-advise niya sa atin paano natin ma-maintain. So yun lang po. Salamat Remy, sana meron kang natutunan sa sinabi ko. Personal experience po yun.
Nako, tandem yung knowledge kasi personal tapos ano pa as a health professional, no. Ang ganda kasi ng sinabi ni Ma'am Legs tsaka ni Ma'am Susan kasi sabi ni Ma'am Legs, kahit na umiinom ka na dati tapos stop ka, hindi ibig sabihin na yung iniinom mo dati at matagal kang huminto, yun pa rin yung iinumin mo kasi pwedeng may iba ka ng kondisyon. So kailangan mag-check ka ulit. Si Ma'am Susan naman, sabi niya na kahit na parang feeling mo okay ka na, wala na kang ibang nararamdaman, may reason kung bakit siya tinatawag na maintenance medication. Perfect, no? So thank you for that, Ma'am Legs and Ma'am Susan. Siguro na natin si Sir Gia dun sa susunog. No? Doc Via, would you like to take the next question? No? I think this one is from Sir Ornulfo Galvez. Yan. So, yeah. Sige, can we have it on screen? Sige, yeah. Can you ask the next question, Doc V?
All right, let's just wait for it to be flashed on screen. Pero Doc Dex, now I know where you got your skills of explaining very well to patients. No? You got it from them, no? That's why. Now I know why you have such great speaking skills, especially dun sa pag-aalaga ng mga pasyente natin, no? And maganda na-explain talaga, no? Not just yung medical part of it, but yung pinaka-personal na part because hindi natin maiintindihan pag sinasabi natin na dapat ganito yung inumin mo to increase your heart rate if you use a lot of medical jargon, yung mga salitang medical talaga or scientific, no? So I think, Doc Dex, you really learned, from the best, no, from in their field. And I guess Doc Dex, no, wala pa yung next question, so I think you can read it.
I think I can read it out na lang din, no? Yeah, I'll read it out. Yan, from Ornulfo Galvez. Go, Doc Via.
All right. There you go. No? Humabol yung ating tech director. Okay. From Sir Arnulfo Galvez, no? Maraming salamat po sa inyo. Itatanong ko lang kung paano mabawasan yung sakit ng binti ko. Hirap kong gumalaw pagtayo. Nakakalakad naman pagkatapos. Anong pwedeng inumin? No? So I think before we answer this, let's hear from Sir Gio.
Okay, Mr. Galvez, ito po yung tanong na anong pwedeng inumin? Una po, ang aming pwedeng sabihin sa inyo ay hindi po tayo basta-basta pwedeng uminom ng kung anong gamot. Mainam babalik ulit tayo dun sa proseso at ang proseso po lagi ay mainam na kumonsulta po doon sa ating doktor para po sila po yung may authority para magbigay din kung ano ba yung nararapat na gamot na para nyo inumin. Sa punto pong ito, ang pwede lang nating magawa as of the moment ay alamin muna natin ano ba yung origin din at ano ba yung dahilan ng pagkakaroon mo ng sakit sa binti. Although ito po ay madadiagnose later base po sa mga lalabas na mga data o sa mga sasabihin nyo na ano ba yung nararamdaman nyo. Kami po bilang mga nurses, pumapalo po kami doon sa tinatawag namin at tinuturo ng ating mga mentor dito na PQRST. Doon po ang aming pinapalo, yung palliative, all about provocative, ano po yung nagkokos, ano po yung nagtitrigger, bakit ka po merong nararamdaman na pananakit doon sa iyong paa. So yun po yung tinatawag nating P for palliative or provocative. Tinatanong din natin, what makes it worse? Ano po yung mga kondisyon or sitwasyon na nagpapalala doon sa pakiramdam ng iyong pananakit. PQ po, kailangan po nating ma-describe dito yung quality. Kaya po laging sinasabi namin, Sir Galvez, kailangan mo pong ma-describe. Ano po yung pakiramdam? Kailangan mo pong bigyan ng description yung iyo pong nararamdaman na sakit sa iyong binti. PQR po, yung radiation or region affected. Ito po ba ay apektado lang ay yung binti na sinasabi nyo? Isa lang po ba? Or dalawang binti ang apektado? So yung tinatawag natin bilateral pain po na sinasabi, pareho ba? Or ito ba ay doon lang sa may buto sa baba, sa may paa? Pero nagra-radiate ba ito? Ibig sabihin po, umiikot ba ito? Pumupunta ba kung saang bahagi ng katawan? Pwedeng sa paa, aakyat, kung saan pa man po nararamdaman. PQR, S po yung severity. Napakahalaga po ng severity kasi po ang doktor natin magbibigay sa atin ng kailangan na ba talaga ng pain reliever base doon sa severity na yung pong severity pag tinatanong namin ano ang scale, gumagamit po ng parameter na 1:10, yung 10 sasabihin natin, Sir Galvez, ang 0 po or 1 ito po yung less na masakit pero ang or halos walang sakit, pero yung 10 po ito po ang pinakamatinding sakit. Paki-rate nga po sa atin para malaman natin ano po ba doon ang inyong masasabing numero na katumbas ng inyong pain na nararamdaman. PQRST, yung pong ating T will be yung timing. Gaano kadalas? At saka ito ba ay lagi na nararamdaman or dito po sa binabanggit nyo, may nababanggit kayo dito, parang pag naipahinga ata kasi nakakagalaw naman pag kayo. So, yung pong pag-inom ng gamot, una, hindi po yung basta-basta iinom na lang tayo. Babalik po tayo pag sa isang matanda, meron tayong tinatawag na polypharmacy. At yun po naman ay dahil dun sa mga dami ng iniinom nyo na gamot. Kaya binabalidate po uli natin gaano at ano ang mga iniinom na gamot. Kasi ang mahirap po sa matanda yung tinatawag nating magkaroon ka ng polypharmacy. Ito po ay yung sa sobrang daming iniinom na gamot, nagkakaroon siya ng epekto doon sa kondisyon at iba pang kondisyon sa katawan. So,
grabe.
Yun po.
Ang comprehensive ng discussion ni Sir Gio, Doc V, as in, iba kasi talaga yung vibe pag yung nurses yung nag-explain. Kasi, truth of the matter is, most of the time, sino pa talaga yung kasama ng pasyente? In the hospital and in the community, talagang yung nurses yung kasama and talagang part and parcel ng ginagawa ay yung pag-explain sa mga pasyente in the best way possible. So, halatang sanay na sanay sila, sila Sir Gio, tsaka sila Ma'am Leg at Ma'am Susan pagdating dyan, no? And tamang-tama po yung sinabi ni Sir, lalo na nung sinabi niya na maraming kailangan follow-up questions, yung ating PQRST, tapos wag po yung nakikita po kasi natin sa TV, no? Merong i-advertise na gamot, tapos iinumin na kaagad para mawala daw yung sakit. So, yung iba po kasi parang 5-5, 10 na po yung iniinom na pills para lang po gumanda yung pakiramdam. Nako po, medyo delikado po ng konti yun, kaya tayo po ay kumonsulta. So, or magtanong po tayo sa ating
Ma'am
mga
Legs
nurses.
has something to say, no? May ata, may dadagdag si Ma'am Legs, no?
Oo, kasi na-appreciate ko yung sinabi ni Gio, pero gusto kong susugan. Kasi ang tanong niya, paano natin matutulungan siyang mabawasan yung sakit? Tama yung sinabi ni Gio na ano ba ang dahilan kung bakit sumasakit? Kasi kalimitan yan, yung muscle ba ang masakit o yung bones, yung mga joints? Kasi pain talaga, sakit ang mararamdaman mo pero hindi mo alam, muscle ba, kalamnan ba o yung buto o yung joints ng buto. Dapat tingnan yon. Pero sa kanyang kwento, at saka madami ding dahilan, kulang ba siya sa electrolytes na sinasabi natin, yung sodium, potassium, chloride, yon, and calcium, napaka-importante yon sa movement ng legs and muscles. So, pwede din naman na kaya sumakit dahil naipit ang ugat or decrease ang circulation. So that could also bring pain. So madami pong dahilan. Pero ang gusto kong maitulong sa inyo, Mang Arnulfo, ay sa kwento nyo, masakit bago tumayo. So siguro po, ang importante, kailangan bigyan nyo ng panahon ang sarili nyo. Bago kayo tatayo, medyo i-wiggle, ikilos yung mga paa, parang ginaganon. At straight, bend, and see if it would help. Kasi madami din naman po tayong magagawa para maibsan ang sakit. Subukan po ninyo yon. Pero yun po, kailangan po talaga ay good diet. Tama po bang electrolytes nyo? Kumakain po ba kayo ng mga pagkain na may potassium? Tulad na saging, napaka-importante, may potassium po yon. Calcium, yung mga fish, napaka-importante din po yon sa muscle and joint health. Yun po ang dapat natin. At syempre po, exercise talaga. Hindi dapat kalilimutan yon. Pero hindi mag-e-exercise kung masakit na masakit. Pero kailangan pa rin po ang exercise. Yun po ang masasabi ko.
Can I add something?
Yes, ma'am. Sige po.
Kasi I'm thinking of my mother. Ah, sa habang nag-a-advance ang age natin, hindi ko kasi alam kung ilang taon na si Sir Arnulfo, no? But I guess once you reach 70 and above, pain is usually a part of your daily life. My mother, uh, she has been constantly complaining of pain in her lower extremities. But of course, to rule out any other pathologic condition, we have already subjected so many diagnostic tests, and it's a good thing wala naman siyang problema sa ugat niya sa legs, no? I think bottom line is because of her osteoporosis that also affected, no, her mobility. So initially, kagaya ng advice ni Ma'am Lex, na lalo na paggising sa umaga, parang mabigat yung legs niya. So, in-encourage namin siya na yun nga, i-wiggle, mag-flexion extension siya muna dun sa paa niya, and then yung knees niya, hanggang sa maka-gain ng strength yung lower extremity niya. Pag ready na siya, then she sits up, and then stands up. Dahil she also had a history of fall, gumagamit siya ng walker o kaya ng cane. So, but the thing is, kailangan ng suporta ng mga elderly or mga older person kasi they lack motivation, and sometimes they get depressed by having this kind of painful feeling all the time. So, they also, motivation, how do we do this? By giving some distractions then, no? Something that they prefer to listen to or to watch, like her. Siguro habang tumatanda ka, mas nag-glue na yung eyes mo sa TV kasi iba-iba yung nakikita mo. My mother, really, pag wala na siyang ginagawa, nanonood na siya ng TV. So, part of her exercise is naglalakad-lakad siya around the house, does chores like washing dishes, etc., helping in cooking. Pero talaga, na-notice ko na after a while, nakakalimutan niya yung pain, pero sabi niya sa akin na hindi siya pwedeng lumakad ng matagal or tumayo ng matagal because bumabalik yung pain. So she really has to lie down again. So ang masasabi ko lang, kung kailangan ng konsulta para tama ang assessment kung bakit. Maraming bagay yan. Depende sa edad natin. Even me, for example, I am going to be 65. I cannot stay in the same position for more than 2 hours because I would feel difficulty. Nahihirapan po ako. Kunyari, nakaupo ako ng matagal, nahihirapan po akong tumayo agad kasi parang naging stiff na po yung aking mga extremities. So, important factor po yung wag po tayong bumigay na magpahinga palagi dahil ganito yung feeling. Medyo mas alamin natin na habang gumagalaw po, mas na-stimulate po yung ating mga bones and muscles, and matotolerate natin more activity pag nasanay po tayo. Yun lang po yung masasabi ko. Thank you. I rehab.
Thank you, Ma'am Susan.
Dex, sorry, rehab is good for quite a while. But then they realize that rehab has very little effect on them as they grow older. What they found out sa akin, sa nanay ko, is to parang pilitin niya yung sarili niya na lumakad or do something na wag nakahiga. So, yun lang. And they find that parang worthwhile to, that is an achievement pag naglalakad siya. So, yun. Thank you.
Absolutely. Ang daming factors when it comes to difficulty moving, no? Lalo na yung sakit yung kasukasuan, may pwede kang osteoarthritis, no? Yung patatayo ka, tapos parang masakit, pero pag naglakad na, medyo okay na, no? So I think it's time for us to have a quick detour already, pero shout out to the Lavides family, Samson family, Roderos family, and everyone else watching. So for right now, it's time for an Alaga Health update.
Go ahead.
Yeah. So for this segment, I think we're going to be jumping straight to how exactly it would be easy for you to join or become a part of Alaga Health. So let's get to it. No, I'll share with you my screen in just a bit. Okay, let's go. Check lang natin, no, with our tech team. Let's show them exactly how easy it is to sign up for Alaga Health. Okay. I'll actually even show you an ad that just came out today from Globe Telecom. So, pakita natin yung ating screen natin in just a bit. So, hold on. So far, no, ang nakikita natin, ang daming questions about healthcare, lalo na for our elderly. So far, napag-usapan natin ng hypertension, yung hirap sa paggalaw, and several others. So, let's continue and give them a sneak peek at how to use the Alaga Health platform. Yan. So, let's share our screen very quickly. Yeah. Okay. So, it looks like we're just having a bit of technical difficulties. But don't worry, we'll get back to that in just a few. Okay, so maybe it's time for us to ask another question before we get to that, no? Let's ask this question now from Ma'am Susan Jimenez. So according kay Ma'am Susan, ay kapangalan ni Ma'am. So sabi niya, good eve. Ako po ang nag-aalaga sa nanay ko sa bahay. Hindi na po siya masyado makagalaw kasi na-stroke. Paano po ba siya mas magandang alagaan? Yan. Okay, so let's jump to that very, very quickly, no? Any quick responses? Who wants to take this po? I think more on caregiver. Ito naalala ko palagi nursing diagnosis before. Caregiver role strain. Nako, naalala ko yun. And I think this would be a good example of that. So sino po kayo gustong sumagot ng ating question?
Parang gusto kong sagutin yan, Dexter.
Sige po, ma'am. Go ahead po.
Aling Susan, alam niyo po, nasa inyo ang buhay ng pasyente at malaki po ang magagawa nyo. Ang problema po talaga sa mga na-stroke ay yung hindi makakilos ang pasyente. Depende po. Usually, kalahati lang ng katawan, depende kung alin ang naapektuhan sa utak. Pero yung sinasabi niyo po na kung paano maaalagaan, ang primerang dapat po nating alagaan ay ang epekto ng hindi paggalaw. Kasi pag hindi gumagalaw ang pasyente, lahat po ng sistema ay naaapektuhan. Maapektuhan po ang baga dahil magkakanyumonya pag hindi natatagilid o naikikilos ang pasyente. Ang puso po at ang ugat ay hindi po nag-open and close yung ugat, yung valves ng ugat kung hindi na-move ang muscles. So napaka-importante po 'yon. Yun din po tiyan. Pag hindi po kumikilos ang isang pasyente, pwede po magkahabag, mahina ang kilos o paggalaw ng mga bituka. So pwede din po magkaroon ng tinatawag nating constipation. Pag hindi din po ay kinikilos ang muscles at saka bones, pwede pong magkaroon ng atrophy, maninigas, liliit, at dahil ito ay kokonti ang dumadaloy na dugo at naiipit din ang mga ugat. So, isa po yun. At nasabi ko na po yung hindi kumikilos yung tiyan, so pwede pong magkaroon ng problema sa pagdumi. Isa pa rin po yun. So kailangan po kayo aling susan ng pasyente. At ang masasabi ko po sa inyo, yun kailangan pong ma-exercise lahat ang parte ng katawan halos ng inyong pasyente. So tutulungan niyo po siya na ikilos ang kanyang mga parte ng katawan. Siyempre po mag-uumpisa kayo sa kamay. Lahat po ng joints ikikilos kasi po pag ang mga joints ay hindi kumikilos, naninigas na po yon. At ang isa pong policy na sinasabi ko sa mga matatanda at saka mga na-stroke, if you do not use it, you will lose it. So kung hindi mo kinilos ang kamay mo, hindi po yan, parang diretso na din siya. Di ba? Parang gano'n na kasi hindi mo na exercise. Naninigas na din po yun. Tapos lahat po ng joints ine-exercise. Kung malakas po itong isang kamay, isang parte ng katawan, tulungan nyo siyang tumulong kung paano pakikilusin ang mga kamay. Tapos yung paa po, kung hindi niya maano, ikikilos nyo din po. At napaka-importante po, ang isa pang problema ay sa skin. Pwede pong magkaroon ng sugat, yung tinatawag po natin ectopitus or pressure sores. Yun. Pressure sores. Kasi po, kaya pressure sore, naiipot po yung ugat at hindi dumadaloy ang dugo, masisira po ang muscles and skin. So, kailangan pong ite-turn ang pasyente kada 2 oras. At minsan po talagang mabigat mag-turn, kailangan nyo po ng katulong. Medyo inalis na nila yung draw seat pero kailangan may draw seat kasi mas madaling ikilos ang pasyente kung may draw seat. Lalo na kung feeling ko si Aling Susan, katulad ko na medyo may edad na din siguro, kaya siya yung nag-aalaga. So kailangan po kayo. At syempre po, ayun pong, kahit po anong exercise nyo sa lahat ng parte ng katawan, kung walang sustansya o yung pagkain po, napaka-importante. Kasi ang kalusugan po ng isang tao, hindi lang ng nakatatanda, ang kalusugan ng isang tao ay maraming dahilan. Ang pagkain po, napaka-importante. Ang isipan din po, pag laging aburido yung pasyente nyo, hindi din po maganda yun. Tataas din ang pressure ng, tataas po ang BP niya. So, kailangan po, ang isipan ng isang may sakit ay pasayahin din. At yun pong ugali nyo ay nakakahawa sa pasyente. So, pag yung pasyente naman po, kailangan din wag masyadong masungit kasi pag nagsungit ka naman sa bantay mo, kawawa din naman ikaw, sa'yo din babalik yon kung ikaw ang pasyente, di ba? So, kailangan ang good teamwork ng pasyente at saka ng nagtagapag-alaga. At tulad po ng sinabi ng ating Panginoon, love should always prevail in us so that the hard work that we do is not hard work, it's a work of love. So, napaka-importante po yun. So, isipan, pagkain, ehersisyo, napaka-importante po yun. Alam kong madami pang maidadagdag ang iba.
Sobrang comprehensive actually.
Comprehensive na.
Sobrang comprehensive na po siya, ma'am eh. So before we actually go to the next one, no, I think it's time for us to do, I think we're okay na, an Alaga Health update.
Sige.
So this is Alaga Health update. Yes, back-to-back segments po ang gagawin ko ngayon, no? Kasi combo package na. Pakita ko na muna yung first part, no, dun sa Alaga Health update. So I'll share my screen right now, no? So, yan. Pakita ko po muna, ito po ay posted ng Globe, I think yesterday. Tungkol po siya sa Alaga Health ng Globe Telecom. So I'll just play the ad right now.
The first ever and the biggest 5G hackathon has ended, but new technological breakthroughs have begun.
Alaga Health!
These great minds are now ready to own the future and create a positive change through the use of 5G technology, all towards Globe's continuous efforts in making a first world network in the Philippines. Together, let's change the world and improve the way we live. Dahil atin ang mundo.
Yan, so that was the ad from Globe. No, that's the ad from Globe Telecom. So actually, that was my Facebook profile. So actually, I'll show you right now how easy it is to sign up sa Alaga Health, right? Okay, hold on. I'll show you how easy it is to sign up. No? So pakita ko yung dito sa inyo how easy it is to sign up for Alaga Health. So whether you're a doctor, a nurse, or any health professional for that matter, there is a place for you sa Alaga Health. So, Pakita ko right now. This is the Alaga Health website. This is www.alagahealth.com. I'll show you the screen. Right? Okay. So I hope you can see it now. Yeah. So this is the alagahealth.com website. So scroll lang kayo. So with beautiful animations siya. You can actually check it out in just a bit. And then you can see here sino po yung mga sumusuporta po sa atin, including UNDP and several others. And why we do this, no? Kung bakit po mahalaga na tinutuloy po natin yung Alaga Health and the services we offer and the apps that we have. And even our advocacy partners, the different organizations. Nako, sasama ko na po dito ang GNAP, part of our advocacy partners dito sa Alaga Health. And ang papakita ko po sa inyo, paano po mag-sign up. So click niyo lang po yung nandito, no? Top right corner, sign up. And then lilipat kayo sa isang landing page kung saan doon kayo magre-register. So in 1 to 2 minutes tapos na po siya kaagad. Ganun siya kabilis. Kasi pagdating nyo dito, magre-register kayo either as a patient, pasyente, or partner, health professional. Napansin nyo po, hindi doctor yung sinasabi namin. Kasi naniniwala kami na health workers can all come in and join as health advocates. So, pwedeng konsulta sa doktor, pwedeng nurse educator ang inyong ibubook via teleconsult, o kaya ang home service when it comes to yung mga swero, NGT, etc. Or kung ikaw naman ay may mga business tungkol sa health, dito ka sa admin app. So, sample natin to sa mga viewers natin how to register with Alaga Health. Of course, data privacy, basahin po natin and make sure that this is checked. Just press continue and fill in your details. Ang bilis lang po niya. In 1 to 2 minutes after you put in your password, press continue and voila, you're already part of Alaga Health. Plus, ang maganda po, especially to our Android users, very much easy to download na po ang Alaga Health beta version sa ating Google Play Store at ating mga health professionals. Pwede na pong i-download ang Alaga Partners app sa ating Google Play Store. And since napakita na rin kaagad yung interstitial ng ating friends from Hello Doctor, isa segue na sa ating article for the week. No, ang article for the week natin from Hello Doctor, which is part of the Hello Health group that is present in over 9 countries. Sa lahat po ng pwedeng makapartner, Alaga Health po ang kanilang pinili. And ito po ang kanilang featured article for the week. So, care plan for the elderly with diabetes. At ang gusto ko pong ibida dito, no? Ito, ang sumulat po ng article na ito ay isang nurse, si Ma'am Lorraine Bunag. Hi, Ma'am Lorraine. At medically verified ni Doc Alfred Landas. So, ang kakaibahan po ng Hello Doctor, yung articles po nila ay written by health professionals and then verified further by our other health professionals. So talaga makasisigurado kayong yung content ay correct. So maybe, nako, pag bored na siguro sila Ma'am Susan, sila Ma'am Legs at sila Sir Gio sa kanilang ginagawa everyday at gusto nilang mag-write ng articles, maybe they can write for Hello Doctor. Kasi ito, makikita nila, ito discuss yung mga issues ng diabetes for the elderly. Yan, may mga infographics pa sila, no, about that, attention to grooming, skincare, and so many others, foot care. Ay, nako, iiwan ko na po sa inyo na basahin to ng tuluyan. And I invite you to watch also, actually not just watch, but even read articles on hellodoctor.com.ph kasi po, apart from elderly care or older person care, ang dami pa rin po nilang ibang topics from coronavirus, type 2 diabetes, and several others pagdating sa talking about healthcare. So, yung mga i-share nyo po sa Viber, sa Messenger, nako, siguraduhin po medically verified at correct ang ating i-share. So, yun lang po tayo sa Alaga Health update and of course, sa ating Alagang Hello Doctor. So, balik na po tayo sa ating questions. Nako, malapit na palang matapos ang oras natin together. So, let's jump into the next question. At dahil mukhang nabanggit yung sa diabetes, ito yung ating next question from Gilbert de Chavez. Yeah, from Gilbert de Chavez. Ano bang okay na vitamins? Yan. Ano bang okay na vitamins? Yung pampalakas sana na pwede sa may diabetes. Nako, si Ma'am Susan ay napapangiti. Si Sir Gio din ay napapatingin. So, may gusto po bang kumuha ng tanong na ito? Na maghahanap ng vitamins. Ang dami nila nakikita sa TV na dapat inumin. Any recommendation po, Ma'am Susan, Sir Gio, and even Ma'am Lex?
Okay. Gilbert, ako ay isang diabetiko, isang taong may diabetes na may edad na. sa currently, at natutuhan ko to sa mga ibang doctor, mas importante sa akin na kumakain ako ng tama at varied yung aking mga meals a day. Ang feeling ko kasi, hindi ko kailangan ng vitamins kung meron akong adequate intake. Although sinasabi nila na hindi lahat naman ng pagkain ay may enough value or amount of vitamins in them. So talagang kasi daw konti lang daw ang content na vitamins ng mga pagkain na tinitake natin. So, kung ganun man yon, palagi kong iniisip, ano kaya yung kulang sa mga kinakain ko every day. So, usually sa edad ko, pati doctors ko na geriatrician, hindi din siya nagsasabi sa akin na mag-take ng vitamins. For as long as I eat the adequate and the correct amount of food, varying food and drinks that is acceptable for a patient with diabetes, okay naman. But if really I would request for vitamin, tinatanong ng doctor ko kung ano ba yung activities ko everyday. Kasi pag madaming stress or madami akong activity na ginagawa at very stressful ang trabaho ko, then he adds madami. Pwedeng yung mga multivitamins na for the elderly. Hindi ko na ipopromote kasi syempre baka so madami po yun. Tapos, sinasabi din kung ako, ang feeling ko sa sobrang ginagawa ko, feeling ko ay bumababa ang immune system ko, then nagtitake lang ako ng regular na vitamin C na doses. Tapos, kung talagang, kasi I have never had a problem with my CBC. So I have never been anemic. So even at my age of 64, going 65, kaya hindi ako nagtitake ng mga like, mga for hemoglobin enhancer, mga yan, vitamin D, maybe calcium for my age, with vitamin D to facilitate its absorption. Vitamin E, never have I taken it, although sinasabi ng mga lalo na pang beauty daw yon and pang skin, pwede. But I have never, mas pa nga nagtitake ng vitamin E ang husband ko kesa sa akin. But maraming bagay na kailangan i-consider. But I guess, hindi ako makaka-prescribe ng certain vitamin lang. My husband, because of his aches and pains, he was prescribed vitamin B complex kasi palagi siyang nakaka-feel ng cramps and parang some numbness in certain extremities, kaya yun. But I have never felt that. So, hindi din ako nagtitake ng vitamin B complex. So, I guess, kailangan pong alamin ninyo sa sarili ninyo, ano po ba yung lifestyle ninyo, ano po ba yung mga usual na kinakain nyo. Kung kulang kayo, then it's better to consult po either a doctor, a nutritionist, a dietitian, kasi po mas magandang source ng vitamins and minerals ang mga pagkain. Kung meron po kayong mga habits or what shall we say, vices ba yun? Like smoking and drinking, these are vices that will deplete your nutrition sa body ninyo. Kahit feeling nyo madami kayong kinakain. So yun, kailangan po lang pag-aralan nyo yung sarili ninyo. Yun. Sorry po.
Thank you.
Sorry ko.
Parang gusto kong susugan yung sinabi ni Susan. May oras pa ba?
Sige mo, ma'am. Go ahead po.
Kasi tama yung sinabi ni Susan, pero yun na nga, mayroong kasing ibang tao na ang lakas ng paniniwala sa vitamins, di ba? So kung ang feeling niya ay kailangan niya, hindi naman masamang uminom ng vitamins. Pero yun nga ang sinasabi ko, kung tama ang dami ng pagkain na may vitamina, sapat na yon. Pero depende din kasi pag nagluto ka na overcook, nasisira na ang mga vitamina. So, marami po tayong kinukonsider. So, ang masasabi ko po, pati, yun pong vitamin C. Alam niyo po ba yung medium size na kalamansi, 100 milligrams of vitamin C na yon. So, 5 kalamansi sa isang araw, may 500 milligrams ka, which is the minimum dose of vitamin C. Tapos po, yung sinasabing calcium, ay yung kahit naman po anong dami ng calcium, kung wala kayong vitamin D na ibinibigay ng ating mahal na araw, ang ating araw, mga 10 to 15 minutes po pag mainit, pero gusto ko pong i-correct, yun pong pagpapainit sa umaga ay hindi po yun ang tamang pagkuha ng vitamin D. Ang tamang vitamin D is between 10 a.m. to 2 p.m. when the sun is shining. At depende sa init ng araw. Kung mainit ang araw, 10 to 15 minutes lang po, you got your dose of vitamin D. So, kasi kahit na anong calcium meron ng katawan mo, kung wala yung vitamin D, hindi din masyado nga po proseso ng katawan. So, yun po ang masasabi ko. Kung ang feeling nyo, ang vitamins ay makakatulong, wala pong masama. Kasi it give you peace of mind and feeling of wellness. Kung feeling mo may ginagawa ka sa sarili mo. Hindi naman hindi naman po lahat ng vitamins ay nakaka-overdose. Kung ordinaryong vitamins po, hindi po yun makaka-overdose. Pero kung magbibigay yon ng magandang konsensya mo at feeling mo inaalaga ng sarili mo, kahit ano pong vitamins pwede pong inumin. Yun po ang masasabi.
Matutuwa ako. Baka may mag-advertise na dito ng vitamina sa susunod.
Hindi talaga. Gusto ko lang idagdag, kunyari magpapakonsult, kasi hindi ko alam ang edad ni sir, no? Pero ang advice ko lang dun sa mga may edad na kagaya ko, kung talagang nagtitake kayo ng mga vitamins sa iba-ibang klase, I'd rather you bring them or list them and consult your doctor. Kasi sometimes, the interaction of your medications to different kinds of, like yung vitamins, for example, baka mamaya, yung vitamin nyo palang isa, it already contains the rest that you're taking. So, yung mga ganon, dalhin na lang para makita and then ma-advisean mabuti.
Yan. Perfect. Swak na swak. And, actually didn't notice na tayo. Nag-enjoy ako. Feeling ko
It's already 9.
And it's actually already 9. But before we go to the last part of the show, shout out again to the Lavides family, Marababon family, and several others who are watching. Special shout out from Doc Joan, May Perez, Doc Joan Real, of course. Good evening daw. Great discussion and amazing guests. Actually, si Doc Joan po ang ating co-host din sa Happy Hour for Mental Health na happening every Friday. Nako, tuwang-tuwa si Doc Joan sa inyo. So, since you're already, humahabol ang Borlagatan family. Thank you daw for this episode. So, thank you for watching also. So, maybe it's time, since it's already past 9 o'clock, it's time for us to do the Alaga Health wrap-up. Yeah. So, it looks like we have the wrap-up time, wrap-up season na. So, let's ask our guests, final words. Any final words for tonight, recommendations, tips, kung meron kayong upcoming event or convention or project, time to plug na po ang ating GNAP endeavors. So, siguro umpisahan natin with Sir Gio. Sir Gio, final words po.
Okay, una, maraming salamat Dr. Dex and Dr. Via sa Alaga Health. for inviting GNAP. And we're hoping na yung binanggit ni Doc Dexter all about GNAP being a partner of Alaga Health, we're going to push through with that. And we're going, of course, to add some possible inputs for how are we going to really address the care needs of older person. We nurses as care doer, but at the same time as care coordinator. So that necessarily nasa bedside, but of course the role of the nurse will be as care coordinator as well among the multidisciplinary team, which is the program and the concept of geriatric nursing and gerontology nursing. In line with the celebration of older person, International Day of Older Person last day, as well as of course this long week celebration, October 1 to October 7, binabati natin ang lahat ng mga nakatatanda. Ang mainam ay hindi lang dahil matanda ay laging may sakit. And it's high time for us to move from the concept of rocking chair. Older person's lives, it's not the rocking chair per se, because the idea and the image that we have about older person ay nasa tutumba-tumba lang. And that is synonymous na they are just waiting for their time. And that's not the fact all about older person. Older person are healthy, older person are active, and of course, we need to push all programs that will address mobility of the older person to make them active and healthy. Healthy diet is one as well as of course, improving yung cognitive level. Not only that because you are old, laging tinitingnan natin, wala nang hasa dun sa pag-iisip niya. So there are a lot of possible interventions, pwedeng non-pharmacological, na pwedeng ibigay natin para at least magkaroon ng mahasa. Kasi may questions kanina all about paano ko ba ma-improve yung aking cognitive, lalo na kung sinosuspect na dahil ang memory ko ay bumababa. So maraming mga activities and program na pwede nating i-push and initiate, mga therapeutic management, non-pharmacological as well. Or else, of course, andito ang ating mga doktor for us to give us those pharmacological aspect ng care and management for older person. Ito po ay sama-samang pag-aaruga sa matanda. Hindi lang po ito nurses, hindi lang po ito doktor, but it's a team approach wherein kasama rin po talaga doon ang matatanda mismo na pag-aralan nila ang pagbabago sa kanilang buhay kasi at sa kapangangatawan. Kasi kung hindi nila aware na ito ay normal aging process ba ito na nangyayari sa akin o ito ba ay may pagka-medical condition na ba? Para at least aware sila na kailangan ko ng kumonsulta kay Dr. Dex, kay Dr. Lydia o sa ating mga nurses para at least malaman natin na meron na pong kakaiba akong nararamdaman at pakiwari ko, hindi na po ito basta yung sinasabi natin age-related changes na nakikita natin. So, yung pong kaalaman ay dapat meron din dun sa level ng mga pasyente. Okay, maraming salamat, Dr. Dex and Dr. Via.
Thank you, Doc Gia. So, naman tayo. Yes, go, Ma'am Susan po.
Ako naman ang final message ko lang sa ating mga special clientele tonight is to really accept the fact that the qualifications or characteristics of the older person is not the same as a regular adult. They have the right to feel alive, active, productive, and they don't have to rely on people to feel that way. They need to motivate themselves to be so. And they have to recognize that the people around them will help them become such. Kaya tama itong talakayan na to, Dex, because we do not only want to inspire the older person, but we also want to create awareness among the young ones. Because the older person is a very special population and they need to be nurtured as well. So that sa ibang bansa talagang the older person is really empowered. So dito kailangan natin iparamdam sa kanila na meron pa silang silbi sa ating bansa at lalong-lalo na sa mga bata because they are the source of wisdom para sa kanila, para umunlad lalo ang bansa natin. So yun lang, let's help them become more active, believe in themselves, and provide an environment that they can be so. Thank you very much for this segment, Dr. Via and
Thank
Dr.
you, Ma'am
Dex.
Susan. Woo! Thank you, Ma'am Susan. And to wrap things up, nako, ang nag-iisang walang kupas-kupas na si Ma'am Legs Manahan.
Okay, salamat Dexter. Talagang paborito ko siya. Ha? So Bia, paborito na din, Dr. Bia, paborito na din kita. Anyway, ang masasabi ko, ngayon ay we're celebrating the Healthy Aging Decade. At gusto kong ipaalam sa lahat, hindi lang sa mga nakatatanda, kundi sa lahat. Ang pagiging malusog ay partnership ng isang matanda at ng kanyang kapaligiran. Ang isang lugar, ang mga taong nakapalibot sa kanila ay malaking epekto sa isang nakatatanda. So dapat po para maging malusog ang mga nakatatanda, partnership po ang kailangan natin. At ang gusto ko pa rin pong ipaalam na isang advokasya ng healthy aging, hindi lang po pagtanda, mag-iisip na kung paano magiging malusog. Ang pag-iisip po ng pagiging malusog na matanda ay nag-uumpisa mula sa paglilihi pa hanggang sa pagtanda. Life begins at conception. So doon pa lang po mag-uumpisa ng mag-isip kung paano magiging malusog ang isang nakatatanda. Hindi pag matanda na. So it's a life course perspective. At ang kahuli-hulihan ko pong masasabi ay, ako po matanda na, dapat tanggapin natin na talagang may pagbabago. Accept. Be accepting of what's happening as long as it is not pathological. Okay? But, ang isa ko pa rin sasabihin ay, huwag niyo pong iko-kumpara ang sarili niyo sa iba. Dahil tayo po ay iba't iba. Doon po nag-uumpisa ang kulang ng peace of mind kasi lagi niyong ikinokumpara ang sarili niyo sa iba. Iba po kayo, unique po kayo. So ano po ang ginawa niyo? Ano ang naging epekto ng ginawa niyo? So hindi pwedeng, ay bakit siya malakas pa, ako hindi na. Bakit siya mahina, ako ang lakas-lakas pa. Pangit po yun. Ang masasabi ko po ay i-accept natin ang ating responsibilidad upang tumanda ng maayos at kung matanda ka naman ang masasabi ko, start low and go slow. Hindi biglaan, dahan-dahan lang. At makakarating din sa patutunguhan. Yun po. Thank you.
Wow, ang
Thank
ganda.
You, Dr. Bia.
Wonderful way to wrap things up.
Dex, can I greet someone?
Sige po, ma'am. Sige po.
No? I'd like to say hi to my father, Philemon Season, who will be celebrating his birthday in November, and he's going to be 100 years old. And I'm so grateful for his blessing. Also, I would like to greet, although I'm not sure she's watching, my mother-in-law also, who has really survived it out, even with dementia. So she's still enjoying life, and we're grateful that we still have her around, although not with us anymore. She is housed in an institution that we have selected for her, and I think she's happy there. That's it. Thank you again for this opportunity.
Nainggit ako kay Ma'am Susan, pwede ba?
Go po, ma'am. No problem po.
Kasi yung advisor namin, si Cecilia.
Happy birthday po.
Ay, magiging
Happy birthday
76
po.
sa Lunes. So, parang gusto ko ding ialay ang aming mga ginagawa sa kanya kasi siya yung aming inspirasyon. So, happy birthday, Ma'am Cecil!
Happy birthday!
Cecil!
Happy birthday! Has been our GNAP advisor since we founded it. Happy
Sir
birthday,
G,
everyone!
Hahabol din ako. Shout out din sa aking mamu, si Mamu Heidi Razalan. Of course, una batiin talaga natin kasi ito ay time nila at panahon nila. Ma'am Susan, the youngest among the senior citizens member ng GNAP, sinabi. And of course, And of course, Ma'am Legs, Ma'am Pearl po, as well as Dr. Araceli, and then Dr. Cecil. So yung ating mga senior citizen within the gerontology nurses, this is your time. And Ma'am Cora, at saka si Ma'am Leti Kwan, Dr. Leti Kwan. So yung mga older person natin within the association, what is good is that we have the younger counterpart, and then of course we look for the wisdom at saka yung kanilang mga inputs na binibigay, experiential, yan ang pinakamaganda, base sa kanilang mga experience, at kami naman, we're going to observe, ganito pa talaga. For us to be fully, to understand yung konsepto ng matanda at how are we going to fully integrate it in the care and management of older person. Ito po ay time nyo, ito po ay oras nyo, kaya ang pagpupugay po namin sa aming mga original na mga nakatatanda sa Gerontology Nurses Association, ang aming pong palakpak at pagbati sa inyo.
At siyempre, ang mga nakatatandang nakikinig sa atin. Sila yung pinaka-importante. Keep on watching po. Babalik kami.
Yes, definitely. We hope to have you here again in the future. Yes. What a wonderful way talaga to wrap things up. Again, special thanks to GNAP for being part of this program. Ma'am Legs, Ma'am Susan, Sir Gio, thank you for joining us. At nako, I think kami ni Doc B, wala na kaming madadagdag. Di ba, Doc B? Wala na rin ako masabing final.
Isa lang yung masasabi ko, Doc Dex. Yeah. Beauty and wisdom really comes with age.
Sweet wine.
That's really sweet, yes. So, isa lang. That's the only thing I will say, yeah.
Ako naman, inspired ako kasi nandito ang paborito kong estudyante.
Thank you so much, Ma'am Legs. No? And that's all the time we have.
Estudyante ko din yan. Pero si
Yes,
Dexter,
ma'am.
paborito ko yan.
Nako. Talaga nag-enjoy po ako sa episode to, special episode for me. Actually, we were actually super overtime, but for me, it's totally okay because it was such a wonderful time speaking with everyone again. So, that's all the time we have. We will all see you again here next week. No, ang focus naman natin mga problema sa mata, problems with your eyesight, at maybe concerning yan ng ating mga older persons. And of course, that would be next Saturday sa Alaga Health Live Check-Up. Pero of course, sa ating mga mental health advocates, join us also next Friday for Alaga Health's Happy Hour for Mental Health. Muli, ako po si Doc Dexter Galban na nagpapaalala, alagaan ang inyong kalusugan para mas umunlad palalo ang ating bayan. See you all next week. Bye! Good evening, everyone!